From Eyewitness News, this is Newsmakers.
Welcome to Newsmakers. I'm Tim White. Ted Nesi will join me on the second half. With all the talk of beaches, or a couple of beaches, and businesses opening up in Phase 2 and Phase 3, the state's judicial system has quietly been getting back up to speed. Joining me now live from the Rhode Island State House to talk about that is the state's top prosecutor, Attorney General Peter Neronha. General, it's good to speak with you.
You too, Tim. Good to see you.
So before we get into the impacts of the coronavirus and how the effects it's had on your office, I have to get to a major headline. We're taping this show on a Friday morning, and as we speak, General, parts of Minneapolis are on fire. Day 3 of riots. The actions come in response to the death of George Floyd, who died after an officer held him down with his knee on the pavement. The incident was caught on video. In general, I'm just wondering, if you saw that video, what was your reaction as the state's top prosecutor when you saw it?
Concerning. I mean, first, your heart goes out and breaks for Mr. Floyd and his family. But when you see a video like that, had that happened in this jurisdiction, the first call is, you want to see the video yourself, with the police department. But look, the law is pretty clear that when there's no need to use force, you don't use it, and you certainly don't use excessive force. And it goes without saying that that video is incredibly concerning and disturbing.
So, this could change by the time a lot of people watch this program, which is most people watch it on a Sunday morning. But as we speak, 3 days, no charges in this case. Obviously, you're not the prosecutor here, but you have dealt with use of force investigations as the Attorney General. And a lot of people are wondering, look, if that were a civilian that did that, a decision either way would probably be made pretty quickly. What are the challenges when prosecuting and investigating police use of force cases?
Well, look, at Rhode Island, one of the challenges is sort of the administrative procedures that departments have to go through when they're dealing with an officer that has allegedly committed a misdeed or a crime. I tried to divorce myself from that. We've actually had 2 cases that have been brought recently involving alleged uses of excessive force. I divorce myself in making my judgments from the administrative proceedings and decide, whether or not the case should be charged, and then we proceed accordingly. I mean, the key there is to get all the information you need to make the charge stand up and hold in the end. Certainly, just looking at it from afar and kind of taking off my prosecutor's hat for a minute. I mean, if you look at the case of Minnesota from afar, there's strong evidence of a homicide there, obviously. The question becomes, what kind of homicide? What's the right charge? To what extent should the other officers be charged, and if so, with what? You really want to get that right. From my own experience, when I was U.S. Attorney, we charged a case by complaint rather than going to the grand jury. And I regretted it, frankly, down the road as some facts changed, that I'd wished I'd had the grand jury in place to kind of get it clarified in the way that I would have liked. So, the prosecutors here have a job to do, state and federal. Presumably they'll do it, but it's an important situation to get it right, because when you bring that charge, you want to make sure that you're going to get a conviction, because otherwise you wouldn't be bringing the charge, obviously, and you really want to have your ducks in a row. You
bring up a good point about grand juries, and I don't know what the situation in Minnesota is with grand juries, but I know what they are in Rhode Island. This was a big goal of yours, I know, General, is to get the grand jury proceedings back up to speed, particularly when you're looking at capital cases, and we'll get into that in a second. But now that the grand juries are starting to convene again, what does that look like during a pandemic? How are you pulling that off? When you think of a grand jury, they're all sitting next to each other. What is the process?
Yeah. Well, one of the things is, across the country, not everybody is. I mean, the U.S. Attorney's Office reached out to us last week to ask us how we were doing it, because theirs hadn't been stood up yet. And I don't know where they are in their process, but it's a hard thing, right? You've got to make sure you can socially distance. Most grand jury rooms, if you think of it, are kind of like a classroom setting with 23 people in them, including the prosecutors and the stenographers. So the way we've done it in Rhode Island here over the last couple of weeks is to find a room that's big enough to spread everybody out. It's not the typical grand jury room. And look, the grand juries have been great about being willing to come in, notwithstanding, the obvious risks that everyone faces in this time. And so we're proceeding. And And the way we're proceeding is we're prioritizing those cases that we simply have to get to first. Cases where the defendant is being held at the ACI and has a right to either have their case heard by a grand jury or be released. And in some instances, we want to get that grand jury decision made, whatever it is, by the grand jury before we're in a situation where the person might be released, because we believe that person poses a danger to society.
Yeah, that brings up my question about the capital cases. As you point out, if you don't get to the grand jury process in a timely manner, the defendant could be released from custody. And often your prosecutors are arguing that some of these folks are a danger to society. Is there a backlog with the
Correct.
grand jury right now? Are there any defendants at risk of being released because there's been this delay?
I don't think so. We were tracking that pretty carefully in March and April, and so we had a sense of, look, when do we have to have a grand jury up and running so that we avoid that problem? And we work with the Superior Court. The grand jury, as you know, Tim, is an arm of the Superior Court. So we worked closely with the Superior Court to make sure that we had that grand jury up and running before we started to run into that problem. But we were very aware of it, and I think sometime in late March, early April, I asked the criminal division to look, let's identify the cases we have to get done. What's the latest we can bring a grand jury back by? And so the grand jury began sitting last week.
So you say it's an arm of the Superior Court, but it's also an investigatory tool used by your office, and a lot of people watching this probably have seen our
Correct.
reporting on the grand jury investigation swirling around the House Speaker's office. I know you will not comment on that. I'm not going to ask you to comment on that, but is right now, with the grand jury getting back up to speed, are they focused right now solely on those capital cases that you and I were just talking about, or are they also hearing evidence in longer-term investigations?
Yeah, look, I guess I would describe it as they're hearing cases that are priority cases. And, most of those cases are, capital cases for obvious reasons, for the reasons we've discussed. But if there's a case that I believe that is a priority, if we're not actively in the grand jury, we're continuing to do the grand jury work that's important to make sure that those cases are moving forward in a fast way. I view my role as Attorney General as making sure that we're moving as quickly as possible on everything that we do. It could be healthcare, environmental enforcement, consumer work, nursing homes is another good example. We had a meeting yesterday about that. I really want to make sure that we're moving fast, because I don't think cases or matters get better with age. And, in many instances, if we're trying to protect the public, the sooner we're in a position to do that, the better off everybody is. So my marching orders to the criminal division and the civil divisions is to do everything as quickly as possible, but of course you have to prioritize.
You caught my ear on the matter of nursing homes there. Obviously they continue to lead the fatalities in this state. What was this meeting about? Who did you meet with, and what was discussed?
Yeah. Well, look, it's not been lost on anybody about the terrible loss in our nursing homes. And so, our Medicaid fraud unit and our healthcare advocate have been tracking those situations very closely. And a lot of complaints have come into the office directly or have come into the office through RIDO. And so we have a number of investigations, or matters I would call them. They're not necessarily criminal, they could be civil, they could be almost regulatory in nature. But we really want to be sure that nursing homes, many of whom are doing a great job in a really hard environment, but we want to make sure that the residents of nursing homes, assisted living centers, congregate settings are getting the kind of health care that they're entitled to under the Medicaid statute and under state law. So when we get a series of complaints, we are tracking them, investigating them, asking for records, sending letters, and if necessary, taking additional investigative steps to make sure that even in this COVID-19 crisis, that residents are getting medical care that meets the standard of care, even in these difficult times.
Have you seen an increase in these complaints about nursing homes during the pandemic, General?
Oh, absolutely. Everything from insufficient PPE, a lack of isolation, a lack of cleaning nursing homes. Now, by saying that, I don't mean to imply that this is a widespread problem that we've necessarily confirmed, but we're getting lots of complaints. So we really want to be responsible about this, and I want to make it plain that most, if not all, nursing homes are really trying to get this right and doing a really good job. At the same time, every complaint that we get, we take very seriously. We chart it, we follow it up. We have a very strong Medicaid fraud team with a lot of personnel that's been working really hard on these cases.
The General Assembly right now has their hands full dealing with the budget and frankly figuring out how to legislate during the pandemic. And I was wondering if you are punting on any of your legislative priorities to next year, or do you have hope that something might get traction this session?
You know, it's hard to say, Tim, we haven't had a ton of contact with the General Assembly. I understand that, the challenges that they face as they try to gear up and address issues at the end of the year, the budget being first and foremost. I guess if I had two things that I think have to be priorities, in large part, driven by this crisis is, we've gotten a lot of consumer calls in COVID. We always get a ton. We've gotten even more now. And so our consumer protection statute needs to be strengthened. I've talked about this a lot over the last 2 years. That would be a priority for me. And of course, our grand jury bill reporting statute is really important given the context of some of the cases that we're working on. So, I hope that those things will be things that the legislature can get behind and support. Certainly we'll continue to advocate for them. And we'll see how it goes.
Can you expand a little bit, if you could, on the consumer division and what role it has played during this pandemic?
Sure. So we're getting lots of complaints about things like, you probably heard, price gouging, travel issues where you can't get the refund you're entitled to if a travel agency or an airline or a cruise line doesn't give you the refund. If they cancel, you're entitled to that. All kinds of issues like that. So that's really sort of been on the consumer side. The problem with our consumer protection statute is it's really narrow. It really limits my office from going after any regulated industry. So think of things like healthcare, think of things like, under that statute, think of things like utilities, think of things like dentist's office, banking, anything that is regulated by another agency, state or federal, we can't go after under our statute, which is almost unique across the country. We've really got to fix that because I really believe our office is the office that can best fight for the people of the state. It's a tool we ought to have in our toolbox.
For this next question, I want to disclose I'm a board member of the New England First Amendment Coalition. In general, this week, the NEFAC and other groups, including the ACLU, sent a letter to Governor Raimondo about an executive order, one of the many executive orders that she has signed. This one suspended certain provisions of the Access to Public Records Act, or APRA, including how long government agencies have to respond to these requests. Your office has input on these executive orders. Do you think that it's time for that executive order to sunset?
I haven't talked to the governor about that, and I don't know that our staffs have spoken, which is really where those conversations take place. I think certainly there is going to be a time, sooner than later, where that has to happen. We all know that getting records together and pushing them out is a challenge. I mean, we oversee that area. We respond to APRA requests ourselves. Yet at the same time, transparency is really important to building, confidence in government. And the sooner we get back to business as usual on that front, the better off I think we'll all be.
Just final question here for you, General. Police departments are telling us that they are making fewer arrests. It's been a bit quieter for them. Misdemeanors are handled locally, and felonies, they get elevated up to your office. Yeah. I was just wondering, are you seeing fewer cases because, police departments are making fewer arrests? Maybe slightly, but yeah, I would say generally speaking, no. We screened in March and April, which were the height of COVID, obviously, over 550 new felony cases, and so that's a large amount of felony cases that kept coming in. I mean, our entire intake unit has really been a strength of the office over the last year and a half, and they really stepped up and got those cases out the door. We're putting new cases; those are new felony cases, so we have to get all the information, figure out what the right charge is, figure out who the right defendant is, and get them charged in Superior Court, get them on the PAC calendar. Those are being scheduled out till August, so it gives you a sense of how much volume has continued to come in. I mean, overall crime, including misdemeanors, might be off slightly, but in terms of the felony matters that we're seeing, maybe down a little bit, but not dramatically. One area, unfortunately, we're hearing that is going up are domestic violence cases. How concerned are you about that? Yeah. Always concerned about that. I think for obvious reasons. A lot of those cases, again, we don't see because many of them are misdemeanors. We certainly see the felonies and we see the ones that the state police prosecute. Those are always challenging cases to, in terms of prevention, you've really got to provide a lot of support for potential victims. And a lot of the
of the advocates and nonprofits are doing tremendous work there in this crisis. But domestics have always been a difficult nut to crack. And you'll even see it sometimes, unfortunately, on the homicide side. Homicides will go up, and there will be, I remember one year we had 6 or 7 domestic homicides a number of years ago. And really thinking about how to prevent that is very different from trying to prevent, sort of a wave of violent crime. So it's a real challenge, but incredibly important to do.
Attorney General Peter Neronha, thank you very much for your time this morning. When we come back, Ted Nesi joins me from the State House to talk about this week in news. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. Joining me now live from the State House, as he does every week, is politics and business editor for WPRI 12, Ted Nesi. Ted, welcome back to the show. And as people watch this, they're probably watching it mainly on Sunday, which is what? The end of May, right? Because Monday's June 1st, I think. June 1st is a big day in Rhode Island. What should people expect based on what the governor has said throughout the week about June 1st?
Well, I think people are going to notice. I'd assume people already are noticing signs of opening up throughout May. You're seeing, if you drive around some places, you see folks eating outside because outdoor dining is allowed. I'm sure more of us are hearing from doctors and other folks that we need to see that they're available again in person. And I think you're really going to feel that ramp up starting June 1st. I think a lot of us are calling to see about when we can go in for a haircut or a dye or whatever people need. We're going to see retailers allowing more people at once in a store, indoor dining with up to 50% capacity. I was talking to a restaurant owner yesterday who said, don't forget they get the 50% capacity indoors, but then some of them didn't have a significant outdoor dining before, and that can continue. So there'll be quite a few restaurant tables available as we get further into summer for those restaurants that are following this. So you're going to see people starting to go back into work, I think, more frequently. And then, of course, I think there'll be a nervous eye in a lot of cases on the case numbers and seeing whether, are masks and social distancing and the continued, efforts to hold the virus down successful even as people do more, or do we see an uptick? So I think, that's what the health officials are going to be watching. But I think it's just life's going to feel a little more normal, but still very abnormal.
And this question might be a little too early to ask you, Ted, but, as we enter phase 2, June 1st, people might already be looking ahead to phase 3. We get a lot of questions into 12 Responds of, have they firmed up weddings yet or any of that? Do we have a sense as to what the potential timing to phase 3 could be?
Yes, the governor clearly would like to hit phase 3 around July 1st. She said, right now she's thinking in terms of 1-month increments to get from phase to phase. So May was phase 1, June will be phase 2, it looks like. And then if June goes well, July will be phase 3 and onward from there. I think, again, I think the governor clearly, first and foremost, her team, they're looking at the case numbers, the hospitalization numbers. They were very encouraged by seeing those stable or even in decline over the course of May, despite reopening around May 9th. So I think, again, they're going to be watching the same thing in June. I think the other thing is we all have to remember that the virus has only been around about 90 days in Rhode Island. So they're still learning a lot about, what makes it. Look at the different advice we've all gotten. Don't wear a mask. Now we're all wearing masks. You can do this, you can't do that. Who is really at risk? I think that's going to allow them to make more fine-grained choices as we go forward. Good example this week was youth sports, where earlier the governor had sounded like, no youth sports this summer, people in contact, etc. And now they're saying, okay, with some safety precautions, you can have practices in June and hopefully games by July. And I think that's because they're feeling more and more confident that masks, social distancing, people practicing hygiene does seem to be holding the virus down. Plus, summertime, the hope is that there's less spread in summer before we get to the fall.
Yeah, and when you hear the governor talk about youth sports, she often says, I'm putting a lot of trust in you that you're going to follow the rules. I'm letting the leash out a little bit more. And we are seeing an improvement in cases. We are seeing an improvement in stats over the past couple of weeks. But still, Ted, a lot of deaths at nursing homes. What is the governor saying about that? I know she gets asked about it a lot.
Yeah, I mean, that has been maybe one of the most striking things to me in May was, if you knew all the data but deaths, you'd say Rhode Island's in a pretty good place. Cases down, the positive rate for the tests is around 5 to 7% most days recently. That's pretty good. Fewer people in the hospital. And yet deaths as of Thursday, which is most recent data as we stand here taping this morning, were nearly the average for the last 7 days was almost at the highest it's been, which would equal what it was at in early May. And to me, there's now like kind of two things going on. You have in most of the population a seemingly stable situation with coronavirus. It's not spreading too badly. The precautions are going well. But in the nursing homes, it's just proving, I won't say impossible to hold down, but it's really tearing through a lot of these places. More than half of the long-term care facilities in Rhode Island have now had at least 2 cases of coronavirus. There are some where dozens of residents have died in the last 2 months and I asked the governor about this actually in Thursday's briefing, and she said, it's infection control. She said these facilities, it is very, very hard to prevent spread of infections. They're in congregate settings, you have shared bathrooms. These are often very frail, often older people who we know are at the most risk. I mean, here's a stat for you, Tim. I looked the other day. If you're in your 30s in Rhode Island and you catch coronavirus, your chances of dying are like 1 in 242. Very rare, like 0.4% fatality rate. If you're in your 90s or older, 1 in 4 coronavirus cases is dying patients. And so, it's devastating to older folks, elderly folks, and especially the frail ones. And so it's just very hard in the nursing homes. We're seeing it. Massachusetts has had an even higher death rate as a share of population. Connecticut, the Northeast, they think part of the problem is when they discharged initially people who'd been hospitalized with COVID into the nursing homes, that allowed it to get in. In some cases, you had workers. The governor called it a perfect storm, and it does seem to be that way, which is not to let officials off the hook by any means for the need to try to get their arms around it, but it's proving very difficult, and that's not just in Rhode Island.
All right, I want to shift gears here now to the budget. This is the biggest challenge, without a doubt, facing the General Assembly, but there doesn't seem to be anything new as we talk on this Friday morning. And I just picture House Finance Chairman Marvin Abney sitting in his office, staring at his telephone, hoping Washington, D.C. is going to call and say, we're coming to the rescue. Is that your impression of what's happening right now?
There's maybe a little more activity than that, but not a ton more. There are conversations happening behind the scenes. The House and Senate Finance Committees have been holding some hearings to get their arms around the budget. But, we had the reporters in the briefing had another conversation with the governor about this Wednesday or Thursday. And, she basically said, look, the deficit we're looking at is $900 million for this current year and the new one that starts July 1st without big time money coming in from Washington. The only solution there is going to be large scale layoffs that'll feed down to the cities and towns, teachers, police, etc. Certainly not say there isn't anything they could cut, but that's a huge amount of the state level revenue. The state only brings in like $4 billion a year in state level revenue, so $900 million off $8 billion over 2 years. That's a big chunk of it. Yeah. But there are signals out of Washington that there probably will be another stimulus bill at some point from Republicans, who are the ones to watch because the Democrats in the House already passed theirs. But when and what does it look like, and how much money is there for a state like Rhode Island? Those are big open questions. And so it might be that you see them pass kind of a holdover budget for July, maybe, while they keep waiting for Congress.
Let me ask you on that, Ted, when you bring that up,
these deep cuts.
Is that a constitutional problem for them to do that? Constitutionally, Rhode Island has to have a balanced budget. Can they just kind of punt it every month without violating the Constitution?
I think there is a way. I doubt it's totally simple, because you're right, Tim, you have to balance the budget. That's in statute. But where there's a will, there's a way. And then, of course, there's a balanced budget requirement on paper, but there are always ways to make it look balanced, or say it's balanced right now, or whatever. There's the rainy day fund, which has about $200 million in it, but that, under the Constitution or statute, has to be quickly paid back. So there are options available to tide the state over for a bit longer, but they're not They're not long. They're barely short-term solutions. You know, they need clarity on whether there's more money coming from D.C. and if not, they're going to have to start putting pen to paper and figure out what to cut.
All right, we got about a minute left here. You reported that the state hired a $20,000 lobby firm to help secure funding, COVID-19 funding in D.C. My first impression when I thought your article was, don't we have a lobby firm in D.C.? It's called the Delegation. What is your impression with a minute left of how this lobby firm's going to be used?
Yeah, I think a few members of the delegation and their staff had the same reaction. What are you saying about us if you think you need a lobby firm? You know, they're using Sean Richardson, who was chief of staff to Patrick Kennedy. He's leading the effort. But you know, I think there's a feeling that, you know, federal money is so important, and that, you know, some of the money that's coming in, there's discretion around who gets it, how it gets put around. And so I think there's a hope that if they have someone advocating for them with the agencies on top of the delegation, they can get more. But certainly it raised some eyebrows in Rhode Island and in Washington too, I think.
All right, everybody, make sure you go to WPRI.com. Our colleague Eli Sherman put together a great chart on what you can and can't do as we enter June 1st, so make sure you check that out. For Ted Nesi, I'm Tim White. Thank you for watching, and we'll see you next week on Newsmakers.